So I think a lot of people wonder what really happens with emergency surgery in the hospital. You know, you see it on TV and people are rushed from immediately the minute they hit the hospital, they're in the operating room before you know it and they're doing emergency surgery. And so I've been doing this for 25 years. I've operated at multiple level 1 trauma centers over my career. And so what typically happens is a patient with a severe injury will first come to the emergency department. They're usually evaluated by a trauma team. The trauma team evaluates them, gets scans of their head and body, and if it looks like there's an issue that may need surgery with the brain or the spine, then neurosurgery gets consulted. So then I get the call, could be the middle of the night or the middle of the day, and then I'll determine, I may look at the films at home or come in and look at the films. If I think it needs surgery for sure, I'll tell them just to get the operating room ready and come in. If it looks like I need to evaluate the person first, I'll come right in and evaluate the person. But at some point, if we decide the patient needs surgery, they have to call, a surgical team in to do the surgery with me. They have to get the operating room ready. The patient, if they need a breathing tube in, have to get the breathing tube in and be stabilized by the trauma team. And then if there's a family around, they have to talk to the family and make sure the family actually wants to have surgery done, depending on the patient's condition. But if the family wants the patient to go to surgery and everything's ready, then we get the patient back to the operating room. Then you have to get the patient positioned the way you want, make sure anesthesia has them fully asleep in the breathing tube in, and then from there you can actually start your surgery. So there's certainly a chain of events that have to happen when somebody needs emergency surgery, and that takes a certain amount of time. But it's not like on TV where all of a sudden the patient hits the ER front door and next thing you know, immediately they go right to the operating room. That doesn't happen in real life that I know of.